Welcome. I'm Dr. Arthur Kolsky, founder and medical director of the Advanced Acne Institute. And in today's session, we're going to talk about a very important tool called the mirror test that will help you go from acne sufferer to acne survivor with the least amount of diversions. So what we're going to talk about today is the mirror test. So here's our mirror. So how are we going to use our mirror to help keep us on the straight and narrow without diverting toward pathways that lead us to a dead end and therefore waste our time and energy that should be spent going from acne sufferer directly to acne survivor? So let's talk about it. So let's say that you're an acne sufferer and you've now made the decision that you're going to do something to help resolve your acne once and for all. So there are a lot of things that you might do, a lot of steps that you might take. You might search on the internet, you might read in a magazine, you might see something on cable TV. We talked about a lot of these things in previous sessions. But for today's purpose, let's think about what happens when you go to the doctor. Let's say you decide you're going to go to the doctor to finally get an official treatment to finally help you resolve your acne. So this is an important one because this is something that trips up a lot of acne sufferers, because the idea is that, well, you're going to the doctor, so you should be getting something that's going to work, and there shouldn't be any question about that. But let me take you through this explanation so that you understand how that's not always the case and how the mirror test comes in handy to help us avoid something like this. So let's say you go to the doctor and you go in and you say, "Doctor, I want a treatment for my acne because right now it's making me unhappy. I'm not happy. I've been suffering with acne for a long time. It's really frustrating me. It really bothers me. I need some help." So now in your mind, you have an idea of what you want the doctor to do. You're thinking about what the result should be. So that is in your mind. So whatever success means to you in your acne treatment program is what you have in mind right now. So you expect what the doctor is going to give you to ultimately lead to that, right? So at the end of this treatment, you want to be able to look in the mirror and see the same thing. So this expectation that you have in mind is what you should be able to see in the mirror after the treatment is done. So let's see what happens. So the doctor gives you a prescription. And tells you, all right, go home and use this and see me again in 2 or 3 months. Okay, so you're now expecting to get this. So you use the treatment, and what happens? So there are different outcomes that can happen. So one outcome that can happen is that you end up exactly with what you expected. So that can happen. If the doctor gives you the right prescription, and if your acne is the right type to respond to that prescription, there is a good chance that you can end up with meeting your expectation. And if that's the case, then that's great. And you've gone from acne sufferer to acne survivor, and you're done. You've reached your goal. So those patients don't need any more help. But what about the very significant number of patients that don't achieve that? What if you go through the treatment and you end up without achieving what you expect to achieve? So this happens all too often. And probably this happens a lot more often than the other outcome happens. And a lot of patients don't understand why. And they become more frustrated and desperate because now they've gone to the doctor, they got a real official prescription treatment, and it didn't work. So how could that be? So let's understand what just took place for this patient who didn't achieve the expected outcome. Let's figure out what took place so that how we can use the mirror test to avoid that happening again. So let's talk about some information behind the scenes. Now, when an acne medicine gets the designation from the FDA that it's approved and that the company can actually call it a medicine that helps to treat acne, it has to go through some series of steps. And those steps involve clinical trials where a lot of patients with certain types of acne use the cream in a very controlled environment. They're told how often to put it on, how much to put on. They're monitored, so it's a very controlled environment. And at the end of the treatment, the company counts up the number of pimples that that patient has after treatment compared to the number of pimples that patient had before using the treatment. And in order for that medicine to become FDA approved, that difference has to be statistically or mathematically significant. That means that it can't be something that happens by chance. So we all know that acne has good days and bad days. So some days you might have more breakouts than other days. So we can't just leave it to chance. We have to make sure that mathematically the reduction in the number of pimples that occurred by using this medicine was significant enough that it didn't just happen because you were having a good day when the doctor counted your pimples at the end of the treatment. It has to be enough that it actually made a difference. So once that happens, the FDA says, okay, this medicine is approved, it's an acne treatment, you can now market it to doctors and they can now prescribe it for their patients. So that's what the doctor did here. So why didn't it work then? Seems like it should have worked. Well, did it work or didn't it work? Maybe it did work. How could that be? If it worked, how come this patient is still unhappy? Depends on what you mean by worked. So, for example, I'll have patients come in to see me and they'll have seen another doctor and they were prescribed a medicine. And so I'll say, did it help? And they'll say, yes, it helped. So then I'll ask them, did it help enough where you were happy? And they'll say, no. So there you are. So it might be that prescription actually did help, but maybe not enough. So this patient is still not happy. So let's keep going behind the scenes and think about what that means. So let's say that you come into the doctor with 30 pimples on your face, and that's a reasonable number. Many patients have many more than that. Some have less, but 30 is, if you count every blemish on the skin with a patient with acne, that's a reasonable number. So let's say 30 pimples. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So this patient has 30 pimples. Now, the doctor prescribes this medicine. So let's say that this medicine was approved by the FDA because it provided a statistically significant improvement after patients used it. So what does that mean? So does that mean that it had to lead to completely clear skin? No, it doesn't mean that. And that's where things go off course for our acne sufferer here. It doesn't mean that. It means that it had enough impact where it wasn't just by chance. So maybe this prescription only improves acne by 20% or 30%. And if you really look at many of the acne medicines, some of them are about that much. Some of them might go up to 50%, some of the medicines that are commonly prescribed by doctors for acne patients. So let's say the doctor used one that helps you 50%. So you're going to get 50% better. So what does that mean? So if you're 50% better and you started with 30 pimples, now you end up with 15 pimples. So what does that mean? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So that's what that means. That means that if you look in the mirror, you still see a lot of pimples. So instead of having a good reaction, you're still unhappy. And why is that? Because the medicine, even under the best of circumstances, got you 50% better. And maybe that's not what you expected. You expected the doctor to give you something that's going to make you happy when you look in the mirror. But that's not what happened. So this is where the mirror test comes in handy. If you tell the doctor that, doctor, whatever treatment you're going to give me, when I look in the mirror, when this is done, this is what I want to see. And you explain to the doctor your expectation. It might be 50% better. Maybe that's what you're looking for. And if that's the case, then you've achieved success. Or it might be 100% better, no acne at all. And if that's the case, then you didn't achieve success with this medicine. And a little bit deeper behind the scenes, a lot of the medicines that are prescribed for acne in a general busy dermatology practice, the doctors probably don't have a very good idea of how effective that medicine is. For example, if you ask your dermatologist, what % better will this cream make me if I use this cream for my acne? The chances are that your dermatologist probably won't be able to communicate the % that the FDA saw when they cleared that medicine to be used as an acne medicine. So the doctors often get in a habit of prescribing similar prescriptions that they're comfortable with. They've used it a long time and it becomes a reflex. So every acne patient that comes into the office typically might get some variation of that regimen that the doctor tends to like to use. So it might not be the right one for your particular case of acne. So that's where a lot of acne sufferers get tripped up. And sometimes the doctors don't even realize what they're doing because many probably don't know all of the different medicines. They probably have not looked at all of the data, the recent data, or the data that shows just how effective that medicine is probably going to be. Or they might not have taken into account your particular lifestyle circumstances that may not allow you to achieve the optimal result of a given prescription because you have to follow certain very strict requirements if you want to achieve the optimal result for that particular medicine. So this is where the mirror test can really help out. So if you want to achieve success, you want to make sure that you start with a prescription that's going to have the best chance of getting you there. You don't want to go on a path that is going to lead you to a dead end. So that's what happened here. This patient took a detour off the path from acne sufferer to acne survivor. This patient took a detour that led to a dead end. And you want to use the mirror test and always keep that in mind no matter what treatment you use, whether it's in the doctor's office or elsewhere. You always want to know that that treatment has the potential to give you the results that you're looking for. So that's the mirror test.